Do you need cash? Do you want to consolidate debt? Premier Credit can help. They provide quick and confidential loans for any reason. Their service is same day and most loans are approved within minutes. You can apply in person or by the phone. Their experienced and knowledgeable loan professionals will leave you feeling confident that your loan is being properly handled in a secure manner. Premier Credit can be reached at 225-667-8100, or you can email WeSayYes@premiercredit.com, or stop by and spin the wheel at 139 Del Norte Avenue in Denham Springs. They're open Monday through Friday from 8:30 a.m. to 5:30 p.m. and are a proud sponsor of Local Leaders, the podcast.
Hi, it's Tricia Johnston, residential realtor with Blum with your real estate tip of the week. If you're renting and wondering what the advantages would be to buy, here are just a few. First, as a homeowner, part of your monthly payment goes towards principal. That means you're building equity. And as you make improvements to the property, that'll build even more equity. Second is the tax advantages. If you itemize on your federal tax return, property taxes and mortgage interest are both deductible. Third is the freedom to make changes to the property. If you want to paint or add a patio or fence, you can do that because you own it. And finally, when you're ready to move, you can keep it as a rental property or sell it and use the equity to buy your new home. If you'd like more information about the advantages of becoming a homeowner, or if you have any questions at all about buying or selling, please don't hesitate to reach out to me and I'll be happy to help. I'm Tricia Johnston with Blum, and I'll be here next week again with another real estate tip for you.
The rise lately of businesses all across the area that require physical activity, as well as the rise in popularity of CrossFit gyms and 24-hour health clubs, prompted me to seek out my next guest so we can get insight not only to the options you have locally if you're experiencing pain related to repetitive activity or exercise, but also to get insight into a lady who is known as much for her bedside manner with her patients as she is for her vast expertise. So with that, welcome Cheryl Jeane, Dr. Cheryl Jeane, to Local Leaders, the podcast.
I'm really excited about being here today. I'd heard about you and reached out to you and was glad we already had a relationship, but because I'm excited about what you're doing with this and how it is promoting us locally that are small businesses. So I'm really excited about that.
I'm excited as well. Thank you very much for coming by. And yeah, I just reached out and I thought you would be awesome to talk to. Of course, health is a major thing. And a lot of people don't know that today, October is known for Breast Cancer Awareness Month. But did you know, I bet a lot of people may not know, that it's also PT Month. Is that true?
It is. So we celebrate Physical Therapy Month and we celebrate Breast Cancer Awareness.
Yeah.
And we're extra excited about Breast Cancer Awareness Month this year because we have just started a lymphedema program here in Livingston Parish. So it's the only program in Livingston Parish that offers lymphedema. So we're excited about bringing that service here to the local people.
Yeah. And for the listeners that may not be familiar with lymphedema, kind of tell us a little bit about what that is.
Well, lymphedema isn't just about breast cancer, although a lot of people with breast cancer are likely or have been likely to get it. With technology and the way they're doing surgeries now, it's not as prominent, but at one time those were two things that went together. And so it is when it's typically a limb swells, and it's not just swelling, it's hard swelling. So, and and it can be almost as hard as this table, this rod. Your skin can be that hard, or the tissue underneath it. And left untreated, it can cause complications. But it can be treated, it can be managed, and you can live life to the fullest, which is what we believe in at Triton. So that's why I'm excited about bringing it here. A lot of times those patients need ongoing treatment, and it's hard to get all the way to Baton Rouge 3 times a week or 5 days a week.
You got that right. And anytime you can save a drive to Baton Rouge, obviously that's a good thing. It's Baton Rouge isn't exactly known for its ease of traffic. So I know a lot of people, especially in the Livingston Parish area, if they think that they have to go to Baton Rouge to see about something like that, they almost, there's a lot of people that would say, I just ain't taking care of it, or I'm not looking into it because I don't have an option in Livingston Parish and I don't want to drive into Baton Rouge. So that's fantastic and really good news to hear that you are offering that there at Triton Healthcare. I also want to, get into everything that Triton Healthcare does, but first I want to talk a little bit about the history of Triton Healthcare in Livingston Parish. So how long have they been in this area?
They actually originated in 1999. We had our 20-year anniversary last year. So we had a big party at the office prior to COVID when you could be everyone could cram into the office. Right. Because a lot of people showed up, and I was very humbled that many people came to our 20th birthday party, for lack of better words. So we've been around 21 years. They started because they wanted to serve actually the nursing home population well, and with physical therapy, occupational and speech therapy services. They wanted to do that well, and they've continued to do that. I am in their outpatient clinic, which is on Florida Boulevard across from the library. And actually this week, I had a speech therapist and a physical therapist both say that they liked Triton because of its ethics, and there's other places they had worked at that they weren't going to work at again. They're all old like me. They all have, they may not
like
have
you, whatever.
They may not have gray hair because they color it. I'm calling out all of my girls, but anyway,
they're gonna love you.
We've
for that.
been practicing for a long time, and all of us like to treat patients as a patient, and Triton allows us to do that. So we're very happy about that.
Yeah, it's real easy to find people that are happy with really all of you good folks at Triton Healthcare. If you go to your Facebook, I know lately y'all have been promoting, meet our team, and you would have a little, it's almost like a little story on each individual team member at Triton Healthcare, and the comments that fall underneath that, especially yours, are of people that are very appreciative of your services. You have one of the best bedside manners with your patients, which I think is extremely important in the medical industry of anybody I know. You are very understanding that people don't necessarily understand sometimes what it is you're doing. The medical field in general, a lot of that care is specialized care, and it's hard for people to understand. For example, if you're stretching someone, why you're stretching them, it doesn't make sense to them. And so it requires a little patience. It requires someone who is a giving person and who wants to care for people. That's a nature. That's something that some people are just kind of blessed having. They're born with. And you exemplify that. So and I'm sure your whole team does. So that's awesome.
I learned soon on that the problem is usually nowhere near where the symptom is. And people will say, why are you working your hip? I'm in for my knee. Or why are you working my shoulder? I'm in here for my hand. Or why? So even I've always really worked on educating my people so they know what I was doing and why I was working at different areas, even though I heard them, because I wanted them to know that I hear them, because a lot of times people aren't heard.
Well, let's talk about that education for a minute. So you didn't just start doing this yesterday, did you?
No, I graduated in 1994. Back then, it was a bachelor degree. I did go back and get my doctorate back in 2012. So I have got my doctorate in physical therapy, but it was a bachelor degree back then. So I've been always a lifelong learner. That's something important to me. That's what I wanted my team to make sure that they was lifelong learners. And the ones that are showing up and coming to me are lifelong learners, so they're fitting in well, because you can never know everything about the body.
Triton Healthcare, located at 8128 Florida Boulevard in Denham Springs, offers a wide range of physical therapy services for a number of chronic and acute ailments. Whether it's sports injuries, injuries from accidents, or neurological disorders, Triton Healthcare can take care of it. They offer post-surgery rehab services, which is a specialized sports medicine program, and massage, as well as occupational and speech language therapies. So check out Triton Healthcare, who has been an active part of the Livingston Parish community since 1999 and are dedicated to providing the very best and rehabilitative care to all Livingston Parish residents. They can be reached at 225-791-8666, and they are a proud sponsor of Local Leaders, the podcast.
Ever. You can't ever know anything about whatever profession you're in. You can learn a lot about it. You can become an expert in it. But if you know everything, I think that's when your expert status leaves, because if you think you know everything, then you can't learn anymore and stuff changes.
That's exactly right. And that's something with this show, it's called Local Leaders, the podcast. And the reason I named it that is because the people I have in this show, they're locally minded folks, but they're also leaders in their community a lot of times. They're people that have a lot of experience in their given field. You obviously no exception to that, but it's also their insight into what it has taken to get them to where they are. So what I just heard from what you just said was you are never too smart to stop learning. And you're exactly right. I learn things daily in my business. I learn things from people you would never expect to learn things from. Even the guy that is the least motivated of anybody or gal, there's something that you can learn from him, even if it's to be more motivated. It's still learning, and that's what all leaders do. Now, you have always been involved pretty much in healthcare, since you got out of school. This is all you've pretty much ever done, right?
It is. I graduated as a physical therapist, and I worked in that setting. I worked in Kentucky, and from there I did traveling therapy. So I moved around quite a bit and ended up here in Louisiana. If y'all want to know that could be a whole nother podcast, I guess. Anyway, and I worked in a bunch of different settings doing that. I ended up an outpatient. When I went to school, they taught us see the body as a whole. When I got out of school, they taught us to, like, you had an eval, hip eval, knee eval, ankle eval, shoulder, wrist, elbow. They broke everything up.
All right.
So when my daughter was born, I went back to home health because that setting worked the best with a young child. If they get sick, no one, I don't have patients waiting at 9 o'clock that I have to be there. So everything has to be kosher by 9 o'clock. I had the flexibility with home health. And I started treating the patient as a whole, and not just the patient, but I'm treating the family, the environment, all of it, because that's what home health does. And when I went back to outpatient, which is really where I love to work, I brought back that holistic point into there. So a lot of times I do treat the family, or I treat what's going on in the home. I'm always looking at posture. I'm always like, what's your desk look like where you're working? A huge thing I see a lot with people that get bifocals is they get in their computer with the bifocals. Well, they're doing this.
Right.
Which this is tilting your head up maybe a half an inch so that they can see their screen through the bifocals. That can mess up your neck and cause all kinds of pain. Same thing after the flood. A lot of people put their big screen TVs over their fireplace.
Right. Or up high on a wall.
So they're looking up at it. Now, I think now, because I don't see it as much, they've all got the recliners. So they're laying down to look up and it's not as big of a problem. But at the time, and I've seen people, their recliners cockeyed, so it looks good in the living room, but they want to look up at their TV. So they're looking up to the side for an hour or two a day. And that can just give a lot of neck pain and headaches.
Right. And so we want to get into that a little bit, and we want to get into if someone's noticing they have neck pain. Maybe they do that. Maybe they watch TV, on that, and it's hanging on that fireplace, or maybe their computer is way down here or way up here, where they're either looking way down, one way or the other. They start noticing this neck pain, Dr. Cheryl Jeane, and they're wondering about Triton Healthcare. Should I go in there and mention this to them? So first we want to get into the services a little bit that you offer. And you do offer some physical therapy services, such as if someone has shoulder and neck pain, or if someone has wrist pain, those sort of things. You mentioned posture, which is a huge issue. I went in actually, and you noticed, I went in for some shoulder pain I was having, and you noticed that my posture was a little bit off. I was standing tall like you should stand, but I was a little, I guess, tilted. So my shoulders were not evenly square. And you gave me some I guess you call them mirroring exercises, where I would look in the mirror and kind of adjust my shoulders and try to get used to that. That technique helped me a lot. But those are things that you definitely see people for at Triton pretty frequently, I would imagine.
Yeah, I would say most any pain we see people for and can help with. Obviously, if it's a pain from a medical problem like a cancer or appendicitis or a kidney thing, that kind of stuff. But that's why we have this big form that no one likes to fill out because it takes forever and it's 2 pages, but that screens out all those kind of things. So if we see that, we can say, you know what, you don't need to come to us. You really need to go see your doctor, because this isn't a physical problem. This is more of a medical problem. You need to get that checked out. Sure.
And incidentally, those forms are common anywhere you go for medical treatment.
They are.
And we all hate filling them out, but you have to, unfortunately. Yeah. So if someone does notice that they're having a neck problem or shoulder problem, would they need like a referral to make an appointment with you guys initially, or can they just call and say, hey, I'm waking up every day and my shoulder's going numb. I want to find out what's going on with this, and can I come in and see you?
You can. Our Practice Act changed, I don't know how many years ago now, 5 or 6 maybe. 7, I don't remember. It doesn't really matter. It's changed. So legally, you can come in and see us off the street, and we can do an evaluation and we can treat. A lot of insurance companies still have our old Practice Act language, and they want the prescription, but at some point. But we can always do an evaluation beforehand.
Okay, and that was going to be to follow up with that. I was going to ask you if you accepted insurance. So what you're basically saying is you can come in, let's see what's going on. And if it's something that's going to require an insurance filing, I'm sure you have someone that follows up with whoever's insurance and
yes. And we take most medical insurances. We don't take Medicaid, but we take almost every other insurance that we can.
Okay. All right. And so I also want to get into a little bit cupping. Cupping is something that has become very, very popular with both bodybuilders and MMA practitioners, mixed martial arts, for those that may not know. Cupping, tell us a little bit about what cupping is, how it can help someone, especially in bodybuilding, MMA, someone that works out a lot. Kind of tell us what cupping is, and I guess from your standpoint.
Okay. I'll give you a little history. I started cupping long before cupping was cool, I guess. Isn't there a song about that somewhere? Anyway, I think that was country though. Yeah. But I did it years ago on scar tissues. I was working at the Baton Rouge General, and the Baton Rouge General has a burn unit. and I was in the outpatient clinic, so I would see the burns after they're healed. So I saw a lot of scarring.
Stephanie Berthelot and the crew at SR Enterprise can handle it all, from sheetrock to texture to paint. Give Stephanie a call at 504-432-9284. SR Enterprise, where they spread the paint and you spread the word.
And I also used it on surgical scars, but I used a cupping kit that looked like a snake bite kit. It was little bitty. Then about, 7 or 8 years ago, when I was learning about dry needling, I was also learning about cupping at that point. And I've used it quite a bit since. There's a bunch of different types of cupping. I don't do the wet cupping. That's a whole nother, that's Eastern, much more Eastern medicine. But there's the hard plastic cups that you can get. And I like those if I'm trying to do a big surface and trying to glide like someone's back. Sometimes I'll use those, or some of the silicone cups are more pliable, but the bigger ones you can really work on the whole surface area. I have other ones that I really like because you can, like if you have a tendonitis or something in your elbow, you can put it on the elbow and then you can move through the motion and it lets the muscle move while the cup is sucking, pulling pressure and sucking it up. It just helps to relax the fascia and the muscle tissues all around it. So there's multiple ways, multiple cups, and I use them for multiple reasons.
So what is the benefit of that? Does it I guess speed up the recovery process in your muscles after they break down during working out or training?
Well, I don't know if people have been around cupping at all. They'll see that bruising, which looks like it's a suction bruise.
And I'm actually going to edit in some pictures of some people laying on their back or whatever with the little circle so all our viewers can see what that looks like.
Okay. I may have some. But so it suctions up. And when every other modality that we use is a push in, like if you go get a massage, if you get soft tissue work, it's a manual push in.
Right.
If you have ultrasound, it's a sound wave push in. If you have the TENS unit, that's a electrical stimulation push in. This is one that pulls up.
Yeah.
So it's just another modality, but it goes in a different direction. The bruising comes when the capillaries have been weakened, so they break, basically. And then the more capillaries are regrown into that area, so you get better blood flow. Better blood flow is better performance.
Right, exactly. And hugely beneficial if you talk to anybody in a mixed martial arts type setting or a active person who moves iron and does things like that every day at the gym. These CrossFit gyms especially, there's a lot of people that they do cupping or they go see someone like you for cupping. And so I'm a believer in it. To me, when you're working out, okay, and everybody can relate to this, you're working out the next day, you're sore. Day after that, you're a little more sore. Well, what's causing this soreness is not necessarily, well, it is the workout, but every time that you feel that soreness, it's little tears in that muscle, little microscopic tears in that muscle that are causing your muscles to be sore. And as days progress, you start feeling better, less sore. And the reason you're doing that is these tears are repairing themselves. And then by the third or fourth day, usually that soreness is gone, especially when you start working out after a 5-year layoff or something like that. I mean,
you tend to be really sore.
Oh, it's really bad. And people that run, runners, will get it in their thighs. And that is literally like little muscle tears in there that fortunately they heal themselves a lot of times, unless you have like a major tear, but these soreness tears heal themselves over time. Well, cupping to me, and the difference between that and maybe massaging it out is the point you brought up. When you're sore and someone's massaging that, and let's say it's those little muscle tears, you're pushing on that, you're applying more pressure on that. And in some cases, maybe it could cause a little bit more of a tear than was initially there. When you're cupping it, you're going the opposite direction. So you're not, I guess, applying pressure on that soreness. Now, there are times when applying pressure on are going to help it, I would imagine. And yeah, it's your wheelhouse, but just thinking outside the box, I can see how cupping would be another way to go that in some cases might be advantageous over maybe pressing on a muscle and those sorts of things. So they do offer that. If you're someone, especially CrossFit gyms, we've got several of them here. Cheryl Jeane would love to talk to you. She'd love to partner with you maybe on something like that. And they do offer that service. So I know a lot of people are probably going out of the Livingston Parish area because they don't realize maybe that it's offered here. So that's some food for thought for all you folks out there. Now let's talk about occupational therapy. What is occupational therapy for those that may not know?
Occupational therapy is in an outpatient clinic. A lot of times occupational therapists and physical therapists can do very similar things. We, as a physical therapist, I'm trained, learn the body from head to toe. Occupational therapists tend to concentrate more on the upper body. Our occupational therapist is the lymphedema. I took some lymphedema training way back when. I was working at Baton Rouge General, and I was working there with Chris Perkins, and she did a lot of lymphedema training, and she needed a physical therapist to do it. So, but I do not have the training. I know enough about it that I've done it 20 years ago. That's what I know. But that started my whole manual therapy, and it started it in a different way because of the soft tissue techniques. So our occupational therapist does that also. A lot of occupational therapists have gone on and become hand specialists. Our occupational therapist is a lymphedema specialist. But they work more with a fine motor. Originally, it was more like if you're in a rehab setting, the physical therapist would help you be able to walk and get in and out of bed, in and out of the car, be able to do gross functional movements. The occupational therapist is going to make sure you're safe in the house. Can you cook safely? Can you brush your teeth? Can you dress yourself? Can you do all those kind of things? So that's kind of the difference. She works more on upper body. Yeah. Not that I don't, but she works more on that. But she does lower body with lymphedema.
Right.
So it's not, we both work the whole body. We just kind of specialize in different things. Exactly.
That's her specialty. It would be the upper body. So another service yet that you can get at Triton Healthcare is occupational therapy, and you have an expert there in that field. So speech therapy, okay, big deal right now. A lot of people don't realize speech therapy is not just for young kids that maybe they have a lisp or something. Speech therapy can be also for people who suffer from strokes and they're having to learn how to pronounce words again and things like that. A brain injury, someone might require speech therapy to get over that. I would imagine someone with stuttering issues, this would be something that would be beneficial with, correct?
Yes. And speech therapy also works on swallowing. So that cough that you just did, if you hear that with a loved one every time they drink or they're eating and they're coughing like that, it's because they're not swallowing well, and the speech therapist may be able to help that. They also help with cognition. After strokes, honestly, there's a diagnosis that I just found out about, and I'm not going to remember, post-intensive care syndrome, PICS. And patients have it and their families have it. And when you're in the hospital, especially like that, your life is like in limbo. So the world goes on, but your life hasn't gone on. So there's emotional problems from that. There's physical problems from that. There's memory problems from that. There's PTSD, stress problems from that. All of that comes in play. And that's something we can help at Triton.
Excellent. And so if any of you listeners, viewers, not just the issues I brought up with with whether you're suffering from a stroke or brain injury, or you have a lisp, or maybe you're stuttering. But there's many other issues and where a speech therapist would be beneficial for you. Another service in Livingston Parish that you can get at Triton Healthcare. Tiffany Sicard with HomeKey Mortgage combines the experience and knowledge you need to make your mortgage loan a smooth, stress-free process. Reach out to Tiffany for more information on the vast mortgage programs available in the Livingston Parish area. Tiffany Sicard of HomeKey Mortgage, a proud sponsor of Local Leaders, the podcast.
We are also the only place in Livingston Parish currently that does physical therapy, occupational therapy, and speech. And our speech...
All under one roof.
All under one roof. And our speech therapist will treat pediatrics.
Oh, excellent. So there you go. There's pretty much no age limit there. I'm assuming you'll go as old as you need to go, for lack of a better word, and as young as you need to go. Our
current oldest patient is 96, I think.
Wow.
The oldest one I've ever treated was 102.
Really? Ooh, that'd be. I hope I can hit 102. Even 100 be nice, but interesting. Very cool. So tell us a little bit about the sports medicine services that you offer.
The clients that come to me who are into sports, and they can be your weekend athletes. They can be. Someone asked me if I was an athlete, and I consider myself an amateur athlete because I like a little of everything and I like to exercise.
You're pretty athletic.
But I don't do like sports, team sports.
Yeah.
And I teach group fitness, so I understand the people in that arena. So how people often use us, how's that for some stuttering, is they're used to the body hurting.
Yeah.
Because we've talked about it. When you work out, you hurt. But if it doesn't go away in a day or two, or the things that I have taught them or they have learned, the rolling, the stretching, all that doesn't work. If that hasn't gone away in a day or two, give me a call and I may be able to work it out in 1 or 2 visits. Otherwise, if you wait too long, our bodies compensate. Our bodies, they just do. You say you're going to get up and walk and you have a sore toe and you aren't going to do your normal walk where you go over that toe. You're going to walk on the side of your foot. Not because you said to walk on the side of your foot because my toe hurts, because your toe said I hurt and your body just compensated. I mean, that's an example, but we do it all the time. And then the compensation, you get muscle memory. You know how you play a piano, or you all the drills that they do in all the sports, golf, it's all muscle memory. So if you're doing muscle memory and something's not in the right alignment, for lack of better words, or there's a strength deficit or over tight or over loose or whatever, those things I can help with. And before it gets too bad, it doesn't take too long and you can get back in your game quickly. If it gets too bad, sometimes something tears and then you're out for the season and maybe out for life.
Well, that's exactly right. And you make a good point in that muscle memory is a very important thing in athletics, something like golf especially. But if you have an injury and you ignore that injury, you will develop a bad habit. So you overcompensate, like you say, maybe your ankle is injured, and so you're kind of shifting your weight to that other ankle because, it hurts. And over time of doing that, your body will automatically adjust, and you'll start doing that when you don't even want to. The pain may go away, but you're still leaning all your weight maybe on your back leg when you're doing that drive with a golf club. I'm just using golf as an example, but in these situations, you develop bad habits. Good habits, good or bad habits are both hard to break. You never want to break good habits, but bad habits, if you get into it, it's going to take a little while to break that habit. So that's something that you kind of coach people through when they're there. I know I was doing some things back when I went and saw you that I could have been doing better in my posture, for example. And I was in such a habit of maybe sitting a certain way or standing a certain way that it was not easy to get out of that habit. And I still fight it. But once you kind of, much like starting a bad habit, when you learn the good way and proper way to do something, eventually it will become second nature, which is another way of saying muscle memory. It's just, you don't have to think about it. It just occurs.
Right.
So you are pretty much an expert on those sorts of things. There's no doubt about it. And you also mentioned you do some things outside of just being who you are at Triton Healthcare. You teach some classes and on exercise and things like that. I've actually done one of those. I thought I did pretty good for my first time. But let me tell you, this girl will work you out.
And all we did was stretch.
Yeah. Yeah, but this wasn't stretching like you stretch on a football field. This was like, this was crazy. It was a tough class, but we got through it, and I enjoyed myself. So let me ask you this, Dr. Cheryl Jeane, what is the most avoidable bad habit, in your opinion, that you see people get into that could affect them later in life? One thing I think of is slouching.
Yeah, posture is a big thing. Just being, and it's not that people have to have erect posture all that. You've got to have good posture and good movement. And things can get tight quickly. Like you can go on a long car trip and your hips can get tight, and then you go play golf after that and you're playing golf on a tight hip. Well, you're, like we talked about, the muscle memory is remembering that tight hip, so it's going to keep it there. Yeah. So being aware of your posture, and honestly not being lifelong, taking care of your body in the movement patterns, like making sure you do some kind of a wellness exercise program, whether it be walking, whether it be going to the gym, whether it be swimming, whatever it is, doing something to keep yourself mobile is huge for your whole life. And learning new things, that's for your brain. So you put that in your exercise.
Absolutely. And y'all do offer wellness services as well at Triton.
We do. Sometimes people come in, and wellness services are typically our cash pay services, and people come in because they have a headache and they want to be treated by a physical therapist. And the difference we have versus going to a massage therapist is that we can do the needling if we need to, or if you need the heat and stim, we can do that, or we can do the stim and the needles together if people want that, or we can do the cupping. A lot of massage therapists also do cupping too, but we can do all of that under one roof, so to speak, because that's our license. So people come in for a wellness service. I can't grip anything right now because my hand's going numb every time I wake up. Yes, that can be a physical therapy thing, but also people come in for wellness because they want to just get it worked on and go on their way. So we offer wellness services.
Excellent. And yeah, another service you can check out over there at Triton Healthcare. Now, let me ask your opinion on how important, in your opinion, is basic stretching every day? Should people every day just kind of stretch their body out and things like that?
I think people need to stretch and move because we're way too sedentary every day. Your traditional stretching, where, you stick your leg out and lean forward for your hamstring stretches, all of those are fantastic. I've been learning myofascial release through John Barnes, and he teaches stretching, which is really how we stretched when we were little kids. You wake up and you just stretch and you just kind of move the way you need to move. That's your body stretching the way it needs to be stretched. You're not going to say, oh, I think I want to stretch out my shoulder, and oops, I'm going to stretch it this way, and now I'm going to do it this way and hold it for 30 seconds. Your body just stretches because our bodies know. So honestly, if you could stretch like that for 3 to 5 minutes a day, you'd probably feel fantastic, just like you did watch your animals. Every time, especially the little dogs, they get up, they go to a down dog. Their butt goes in the air, their chest drops down, and they are stretching their toes, and they're stretching. So
yeah, and it's interesting in my household. It's a big joke because everybody knows when Daddy wakes up because you hear and I'm like, I make like a big scream and I'm stretching and but it's my body it's like, I don't know, it's crazy. It's like my whole body just, I'm just stretching out. I don't even know how to describe it, but they laugh at me because they know when daddy's up, because they hear that yeah, that's great. It's not a yell. It's more like, hello, I'm awake. But everybody loves it. And it's very comical at my house. So William Waldrep of TWFG Insurance in Denham Springs can service all of your insurance needs. Offering auto, life, health, and commercial insurance, William Waldrep of TWFG Insurance is a proud supporter of Local Leaders, the podcast. Stretching, very important. I actually have some friends that they literally make it their business that they get up, and the first thing they do before they even get dressed for work or anything is they stretch for about 10 minutes. They literally do the classic touch your toes stretching, and they'll get on the floor and walk their hands out and just kind of, do their back a little bit. And I think that's fantastic. And it's a habit. If you get into it, it's pretty easy probably to maintain.
Yeah. Yoga is another great way to stretch and be flexible, and it affects your mind. The endorphins that you get, or the whatever chemicals, I don't remember if they're endorphins or not, that you get when you run, mm-hmm. You can get the same thing with yoga.
Well, I think exercise in general releases endorphins.
Right.
I feel great after I exercise, or, tired, yes, but you feel just better about your well-being in general, and you feel proud of yourself that you weren't sedentary, because you brought up that word. I think that's a big issue that comes with technology. When you and I were growing up and we were young tots, we were playing outside. We weren't inside looking at a phone or looking at a computer. And there's great things about all this, and trust me, I am Mr. Technology when it comes to putting information out. So I am not, coming down on that. But you have to be cognizant of, because of the society and the technology and how it's kind of changed the way kids play and the way people communicate. You have to make more of an effort to actually exercise and stretch and do those things that are so very important to our bodies, because something that may not affect you at 30 could affect you at 50 because you weren't doing those things, right. Correct?
Yes. And other things have changed. I mean, I used to leave my house and as a teenager, a tween, and go ride my bike for 20 miles. Yeah. There's no way. First of all, I wouldn't leave my house and ride for 20 miles on the roads now here. But there's no way I'd let my daughter be gone for 20 miles by herself.
Right.
It's just the era we're in. You can't, it's a different world.
It is. So be cognizant of that. No matter your age, it is great to get out there. Look, not everybody can go outside and run a 5K. Not everybody can go work out for 2 hours at a fitness club, but everybody can do something. If 5 minutes of doing something is better than 0 minutes of doing nothing. And so anything, just get your blood flowing, get your body moving. You'll feel so much better. And when you do reach that age of retirement or something like that, who knows what benefits doing that then will have on you at that age, because you see people all the time that come in and maybe some of those things were avoidable had they got in those good habits early, I would imagine.
A lot of them are.
Yeah. So let's talk about also with Triton Healthcare and you. You're a big supporter of the Livingston Parish Chamber of Commerce. How long have you been in the chamber?
I think I've been in for, 13, 14 years.
Wow. Long time.
Yes.
And important organization. And I always look at people to support the chamber as a sign that, they're doing what they can to help support their local area and businesses in their local area. You also participate, and Triton participates in nonprofit 5Ks, things like that. I see your Facebook and Triton's Facebook where y'all get together as a team and do the Rotary 5K or whatever it is that you're doing at that particular time. So that's
we try to support, especially the local 5Ks. Mm-hmm. I'll do others, but as with Triton, we try to do local because our dollars are being more effectively spent if it's being used locally, because it's not a great, big, huge organization, and because I want to help my people.
Right. And it's important. It's important for all of us to do that. And it's, when you do these 5Ks and things like that, Cheryl, you're doing something that is in your will. I mean, it's right directly related to healthcare and exercise and staying healthy and all those sorts of things. And so you're kind of practicing what you preach there. And that's a great thing. That's a great thing. People notice that. Let's talk COVID for a minute. Okay. So especially in your position at Triton Healthcare, March hit, COVID hits, and your business was different than nobody else's in that it's like, what can we do? What can't we do? What do we need? Now, you reached out to me and Triton Healthcare had gotten some supplies from me, as far as PPE supplies, things like that. But what was it like during that first week when you had no idea, can we even see patients? I mean, right.
Well, outpatient, obviously, I mean, that slowed way down, sure. The outpatient services. But because we also staff nursing homes, those therapists were in nursing homes, and that's where COVID first hit, when it was so scary. So we were literally at the front lines treating people from day one.
Wow. Yeah. Front lines. And look, this is back, folks, when nobody knew what was going on with COVID. How serious was it? Could you get it just by looking someone in the eyes? Really, nobody had any idea. So those people like you that went out there and said, I got to go to work. I mean, that's huge. That speaks to who you are. Thank you for that. From all of us, because I know that's a commitment that goes well beyond yourself, and I think that's pretty awesome. So I just wanted to make mention of that. Now, obviously, people are kind of getting a grasp on at least how they should handle COVID, and should people feel safe when they go in?
Well, we're a smaller clinic. Because of that, there's not going to ever be a huge amount of people. Yeah. The therapy area is also L-shaped, so you aren't in one giant room. Right. So that does in a whole nother level. Yeah. Because we're smaller and there's fewer people, we really work hard at making sure everyone is 6 feet apart. Before COVID, I'd kind of joke and I'd say, look, there's 5 of us in the room and we're all within 5 feet of each other. Can we really do this? And now I'm she's going to get on the bike. Let's stand up and go move your chair over here 4 more feet or whatever to get you on the other side of the room. We are washing things down. I mean, we washed and cleaned before because we did. We wiped everything down, but we're wiping things down that I never thought of wiping down before, right. Like doorknobs. And I don't know why. I mean, people say those are one of the dirtiest places, but, we're wiping down things a whole lot more than we ever have done. I mean, pillows, we change the pillowcases, but we wouldn't do anything with the pillows, but we're putting them in the dryer on high heat after every single use. So different little things that we've been doing just to keep it very clean.
So for all of you folks out there that, that's a concern, no worries. They take every step they have to take in order to ensure that both their employees and their patients stay COVID free. So one thing that's common in leaders, which you are, is somewhere along the way, Cheryl, they read a book that helped them in their in not only in their business life, but maybe who they were as a person or how they approached their business. I thought it'd be interesting to have a little book club with local leaders where people I had on the show would recommend an author and a book that has made a difference in their life one way or the other, something you would recommend someone else read. So I'm going to ask you for one. I'm going to ask you for an author and a book that I could put in that library. I'll link it to this video and maybe it'll give someone else some help.
Okay. Well, you had asked me, and there was a lot of books that I've read. Some of the traditional ones, Dale Carnegie, read a lot of Ivan Meisner, a bunch of other random ones just because, like I said, I like to learn. The one that has made the biggest difference in how I see myself, how I treat my patients, is more, it's not really a business book. It's called The Body Keeps Score. And it's by Bessel van der Kolk, Vanderkolk.
I'm glad you spelled that.
And I so pronounced it by the letters, so it may have totally butchered it. But everyone has a body. So I think it's an interesting read. It talks about what happens as you go through things and how different people, when they go through things, and how it affects them, how they move, how they live. And it really, really, really made me appreciate what our veterans go through for us. Those who go through the front lines and go through fighting and the trauma and everything that they go through. It made me very much appreciate what they do for each and every one of us.
Very. BJ Pawn and Gun has been servicing the Livingston Parish community since 1990. If you need it, there's a good chance BJ Pawn has it. So go see them in Denham Springs. They're a proud sponsor of Local Leaders, the podcast. Good. Very good. So we'll add that to the Local Leaders library, and we will be linking that book at the in the description of this podcast. Now, and on all my episodes, I like to bring up some fun facts related to that person's industry of choice. Yours obviously physical therapy. So I have some fun facts here that I found interesting. You may know some of these, but maybe our listeners may not. So here's one. Physical therapy actually began as a female-only profession. So began in 1921. The first association was known as the American Woman's Physical Therapeutic Association. With 274 members, its first president was Mary McMillan. Physical therapy was known as a woman's health profession. However, in 1922, they changed it to the American Physiotherapy Association, and men were allowed to join. So, of course, men joined, and it probably messed it all up after that. But for 1 year, actually, it was known as a female-only profession. Very interesting. Physical therapists can treat vertigo. Yeah. So some people don't realize that, but that's what physical, they can treat that. Vertigo is something where you'll get brief bouts of dizziness, but you don't change your movement of your head. You just start getting dizzy. So you might actually see things go by you and you're not doing this. You probably have some vertigo. So if you're experiencing something like that, you can contact Cheryl Jeane, and she can at least give you her expert opinion on that. Telehealth applies to physical therapists as much as anyone.
It does. I am challenged with that because I touch all of my patients, so it's hard for me to telehealth and not be able to touch them, but I can try.
And you can certainly advise them.
I can advise them. If
nothing else.
And but there's too much in the touch.
And one more on that note, physical therapy ranks among the most or among the top 10 happiest job professions. You would have thought it was one, I'm sure, but it is definitely in the top 10, might be number one. And so it kind of elaborates on that. It says, based on median salary, job flexibility, and projected job growth, physical therapist is appealing job for many. And top 10 happiest jobs, people that are in that field. And I would imagine a lot of that is because you're helping people. Any field in which you're helping others has got to be ultra rewarding. And you certainly help everybody you can, and if you don't believe that, go on her Facebook and just look. Everybody loves this lady right here. So, Dr. Cheryl Jeane, how can folks find Triton Healthcare on social media and also contact Triton Healthcare if they need to have any of these services that we discussed today?
We're on Instagram. We're on Facebook, Triton Healthcare. And our physical building is on Florida Boulevard between Jubin and Range, across from the library on the traffic circle.
Best way to tell people. Yeah, right across from the library in the roundabout.
Yep. There'll be more than one traffic circle on there eventually, but right now we are on the traffic circle.
So there you go. And highly recommend. I do have a couple of gifts for you. So it is, as we mentioned, PT month and breast cancer awareness month. So I had to give you something pink. So I'm going to give you something pink and something white. So you get a pink Farrell Calhoun beautiful special edition shirt.
Thank you.
Just in time for Breast Cancer Awareness Month and PT Month. And you also get a Local Leaders, the podcast t-shirt, because you, Dr. Cheryl Jeane, are definitely a local leader.
Thank you.
So that is for you. And I also have a cup that I can't reach at the moment, and I'm not going to get up. I'll just give her after. I'll show this on every show. But it's a cup. This is going to be a podcast etched cup, and it was actually laser etched by Sporting Center, who is a proud sponsor of this podcast, and they do that in-house. They can do it same day in some cases, and they actually use a laser. Me and James Adam McCants have talked about that many times, but I'm going to present you with that after the show. I would like to thank McHugh David for his engineering of this podcast. My guest for today, Dr. Cheryl Jeane of Triton Healthcare, the Livingston Parish News for the space, and all you viewers and listeners for your support. I actually hit, with everybody's help, the 48 hot out of the hot 50. I'm going to try this again. The Hot 50 podcast in the land. Somehow I hit 48, and I'm pretty sure that's because a bunch of people voted for me. I can't tell you how much I love all of you for doing that. Thank you very much. Please spread the word if people are not familiar with Local Leaders, the podcast. We do everything we can to feature local businesses just like Triton Healthcare and could use everybody's support. I would like to thank my sponsors for this show as well, of which Triton Healthcare is one. Thank you very much for that. I simply could not do any of this without all of you. If you're interested in sponsoring Local Leaders, the podcast, or appearing on the podcast, please reach out to me at jim@paintpodcast.com. If you're interested in getting the newsletter, The Weekly Leader, straight to your inbox, I'm attaching a link in the description where you can sign up completely free. Until next time, I am Jim Chapman, reminding you to love your community, support local business, and keep leading. Dane Arnold with Itradexchange has been enabling small business in the Livingston Parish area to save cash through his network of over 300 participating Livingston Parish businesses. Saving cash by trading services with other exchange members is what Itradexchange is all about. For more information, contact Dane Arnold at 225-205-3640 or visit itradexchange.biz.